Okay, Mr. Heng, you may start.
Okay, good afternoon, ladies and gentlemen. And so welcome some new friends. Having new friends put me on pressure to explain more clearly and more concisely. Okay, good afternoon. Today we are going to share the scientific studies that is carried in the article Ganoderma issue number 95. Okay, this is a research that has been published. They carry in the last page. So the title of this afternoon talk is on next page. The title is on Lingzhi supplementation improves the efficacy of cisplatin. Cisplatin is a chemotherapy drug used in anti-lung cancer treatment, and it increases survival rate. Okay, Lingzhi supplementation improves efficacy of cisplatin in anti-lung cancer treatment and increases survival rate. Okay, this is the title of our afternoon topic. All right, let's look at the introduction. Okay, lung cancer, as you know, is one of the most common type of cancer. In actual fact, it's like number 1 and number 2. Okay, and it has one of the highest mortality rate of all cancer globally, be it anywhere, Singapore, Myanmar, Malaysia, anyway. All right. Now, although there are targeted drugs being developed, right, patients subsequently are faced with drug resistance and insensitivity to this Cisplatin-based treatment. Cisplatin is a commonly used clinical treatment for lung cancer. All right. This prompted the need for lots of combined treatments of cisplatin and herbal medicine. Has reportedly exhibited greater efficacy than cisplatin alone. Right? There have been reports that if cisplatin combined with herbal medicine, that improves the efficacy. So the researcher from the Institute of Traditional Medicine, National Yangming Chiao Tung University of Taiwan, wants to study the effects of the combined treatment of Lingzhi and cisplatin on lung cancer. So they found out that the hot water extract from Lingzhi not only improves the efficacy of cisplatin in anti-lung cancer, but also protected the immune cells and DNA of normal cells, and greatly increased the survival rate of the experimental animals. Okay, I mean, like just now I mentioned, cisplatin is good, but cisplatin in its anti-lung cancer treatment always result in DNA damage. They have to damage the DNA in order to kill the cancer cells. That's why it brings about all the so-called side effects, and it reduce all the immunity of the patient undergoing cisplatin treatment. All right. So the study is led by Wei Lun Chiu. That's published in the International Journal of Biological Macromolecules titled WSG, a glucose-rich polysaccharide from Ganoderma lucidum combined with cisplatin potentiates inhibition of lung cancer in vitro and in vivo. So if you want to read more about the research, if you do not so-called what I've explained, maybe if it's not clear enough for you, you want to read more about it by yourself, you type in this title, you can access the research directly. Okay, next page. Okay, we look at the study materials and the method that they use. Of course, the materials naturally is Lingzhi lah. Here the researcher use the term WSG. What it stands for is water soluble Ganoderma. Okay, this is a hot water extract of the fruiting bodies of Lingzhi, then go through a specific process obtaining polysaccharide that has an average molecular mass of 1000 kDa. I don't know what it means. These are biological term, but generally our Lingzhi also YK Lingzhi has this kind of properties. All right. All I can say is that generally our YK Lingzhi has this kind of properties. Okay, in the in vitro study means is study on cells only, the dish. All right, it's not in animal. It's just you see researcher, they're doing the dish on a dish plate, then they scribble some cell on it and they study on it. All right, then they study using the effect of Lingzhi extract and cisplatin on human lung cancer cell, right? A549 cells and murine LLC1 cell. These are cancer cell. The LLC cell is actually a cancer cell that has been copied from this human lung cancer cell, but it is a cancer cell that is pertaining to the mice. All right, that's the only difference. Now, you also at the same time do an in vitro study on human lung fibroblasts, MRC5, and murine macrophage raw 264.7 cells. These are all cells found in the lung tissues, and they are involved in repairs, right, and immunity. All right, they are basically some white blood cells. Okay, then the in vivo study is an animal study trying to see how the cell function, how this treatment function in a live animal. All right. So two models were studied. One is a model on tumor growth. So this LLC1 cell, which is a murine cells, okay, cells that is the cancer cell that is pertaining to the mice, were subcutaneously injected into the thigh of the mice, and then after 21 days they kill it and they extract out the cancer cell and see what is the weight. All right. Two is the tumor homing model. Same thing, the cells are injected through the vein of the mice and go through the blood system and see how the cancer cell react in the lung, like so that it is in our human. When the cancer cell is moving in our blood system, what will happen? All right, after 28 days, they'll kill off the mice and extract out the lung tissues and all that kind of thing to study what is going on, right? Okay, then let's look at the page 2, the methods, study and method. The mice are divided into 4 groups. One is control. Control, of course, means that there's no treatment other than the cancer cell being introduced. Okay, 2 is the cisplatin group, and they inject 2.3 milligram per kilo from day 1 to day 5. It's just like to simulate that the mice undergo this chemotherapy treatment. All right. Then the Lingzhi group, WSG, where the mice are injected through the stomach. Okay, intraperitoneally means in the stomach. 75 milligram per kilo every 2 days. All right, then they have another group, which is a combined treatment where both cisplatin and WSG are combined together and treated. All right. Then, like I said just now, they will have two models. One model measure the growth of the tumor. The other model measure the homing in of the effects through the bloodstream on the tissue of the lung. All right. Okay, let's look at the result. Okay, in the in vitro, the next page, Chanchong. Okay, let's look at the result. In vitro, I mean, one thing I have to mention to you is that all this research are done up to the introductory place. They are done through the animals, and then the next phase of the research will be what they call phase 2, phase 3, that kind of thing. This is like phase 2. So there will be phase 3 where there will be clinical research into it, where the human beings are involved. But that will involve a lot of costs. Usually it is through introductory level, only when they see it. Right. The study then move on to look at the how it affect the remember I was telling you about just now the part on studying the lung fibroblasts and the MRC5 cells. Okay, patients receiving cisplatin-based therapy often faces low blood count, especially white blood cells, leaving them susceptible to infections. You always hear about people undergoing chemotherapy. They have to be all in mask. Everything has to be clean to prevent them from having infection. Why? Because like I said just now also, chemotherapy, how it works. It works by destroying all your DNA. By destroying all your DNA, it kills all the cells, and naturally it kills all your cancer cells. So when you kill everything, you are easily infected, right? So the study examined Lingzhi effect on cisplatin treated raw 264.7 macrophage cells. Macrophage cells is a white blood cells found in the mice. And then MRC5 cell is a human lung cells found in the lung tissue. Fibroblast there help to repair the lung. Same thing like basically pertaining to our white blood cells. All right. So what did they do? They found that cisplatin vivo, the in vivo, the first one, talking about tumor growth, right? The study further explored the impact of Lingzhi co-treatment with cisplatin on tumor growth. Okay, you look at the chart here, B. Compared to the control, the black one, the black line is the control. The control, that means there is no treatment. They just introduce the cancer cells into the mice. They found that the cancer cell has grown quite substantially in volume. All right, but when it the green line is the cancer cell of those mice that have been injected with cisplatin. Surprisingly, the Lingzhi group has a better performance, a stronger anti-cancer activity than the cisplatin group. But the combined performance of cisplatin and Lingzhi is even better. You can see that the tumor growth volume has reduced substantially to below 500, all right, mm's for after 22 days, all right, for the dosage. So what this tells you? It tells you that the tumor suppressive effects of the co-treatment was significantly stronger than whether it is Lingzhi or cisplatin alone, right? At the same time, the co-treatment did not affect the body weight of the mice. So what does it tell you also? It also tells you that this co-treatment is non-toxic, right? Because Lingzhi can help to mitigate the side effect of cisplatin, and as a result, the researcher felt that Lingzhi may function both as an anti-tumor agent and an adjuvant, enhancing the anti-cancer effect of cisplatin. All right. Okay. Next page. Then the study moved on to talk about the tumor homing effect in the animal. I mean, they introduced cancer cells into the blood vein of the mice through the tail, all right, and let it travel to the lung. Then they find out that how they see the difference. They count the nodules, the number of nodules in the tumor in the lungs tissue, all right? So if you look at the chart on the right, okay, the white column shows that it's a control, no treatment, right? With the cancer cell being introduced, you see the nodules is over 20, right? For the lung tumor, right? Or tumor volume is 150, but in the co-treatment, okay, the co-treatment is the one that is on the right, blue color, cisplatin and WSG, right? The co-treatment reduce the number of tumor nodules considerably. We just look at the first chart on the left. You see the white column is more than 20. When the combined treatment, you see it's less than 5 at the bottom. And you can also see that WSG or Lingzhi extract has reduced more than cisplatin itself. Lingzhi itself reduced more than cisplatin itself. The combined treatment of these two also reduce it completely, right? So what does this tell you? It tells you that the co-treatment not only inhibit tumor nodules formation. Tumor nodule formation, that means also inhibit the metastasis, the spreading of the cancer. But at the same time, you also suppress the tumor growth in the lung tissue. Right? Although Lingzhi alone exerted a stronger tumor suppressive effect than cisplatin alone, but the combined treatment, this study is talking about combined treatment. The combined treatment is stronger. Right? The last chart on the right-hand side shows the survival rate. Okay, of course, without treatment, you have the red line. There's the shortest lifespan. All right. Then you have the just Lingzhi treatment itself. Okay, it's the blue line. But you have the the blue line is the cisplatin treatment. Only improves a little bit from the control. from those without any treatment. Okay, but if you can see that if they have a combined treatment, it is better. But if it is just Lingzhi itself, it can improve the survival rate more than the combined treatment. Right, so that's why I say, in addition, the survival rate of the co-treated mice was significantly higher than the control. So you can see the right chart here. The first line is the control. The second line is the cisplatin. The third line is the combined treatment. The last line, the green one, is the Lingzhi itself. Without any treatment, Lingzhi itself increased survival rate. Right? So this indicates that Lingzhi has a potential as a therapeutic intervention for controlling disease progression and extending life in lung cancer patients. All right. Okay, in conclusion, I can say that cisplatin-based chemotherapy is still the most common and effective treatment for lung cancer. Okay, the study demonstrated that the combined treatment of cisplatin and Lingzhi extract enhanced the tumor suppressive effects of cisplatin and increased the survival rate of the LLC-bearing mice. All right. Also, on top of that, Lingzhi reduced the cytotoxic effect of cisplatin. That means the side effect of cisplatin, as the study in the microphage and the fang fibroblast cells. This study demonstrated that Lingzhi extract combined with cisplatin may be a novel cancer treatment strategy. Right? The whole idea about all this is that we want to treat cancer not as a disease, that is to be feared. We want to treat it as though that it is a chronic disease. Right? We can live with it, not the mother of all diseases. That once you get cancer, straight away you must die, right? I mean, people with chronic diseases like the tree hind, they can live for years with it. So the whole idea of having combined treatment is that you want to prolong life and reduce your effect, improve your quality of life. Right? Okay, that's my sharing. Thank you very much.